Good afternoon, everyone. Welcome back. I am Dr. Suyash Bhandekar. I am Senior Fertility Consultant and Endoscopic Surgeon at Apollo Fertility Center, Thane. So, today I have chosen a very common topic, that is fibroids, and whether it's related to your fertility or is it going to affect your fertility in any way. So I'll go with a sequence of questionnaire in some way, so that step by step, I mean, so that everything is clear from clinicians and the patient's point of view. So, what are fibroids? So, we usually call them leiomyoma as well. So, they are majority of them conclude to be like cancerous growth or something. But let me tell you, these are not cancerous. These are the most common growths which are arising from the smooth muscles of the uterus, the wall of the uterus. So, these are very common. Almost 50 to 70% of the girls may have fibroids in their overall lifetime. The majority incidence is during the reproductive age group. So you may not see any incidence of fibroid before getting your periods, that is before menarche or post the menses, post the menopause. Like post-menopausal women don't have fibroids. So basically, it is linked with your hormones and your hormonal fluctuations. So, what are the causes of fibroids? So, there are many number of theories that have been formulated and postulated, but there are two which are like most commonly accepted. One is the genetic thing. So, if you have a genetic association, that it means that in case if your family member, like your mother or a sister, is affected, if who is having a fibroid, there is a high possibility that yes, you also may have a fibroid in your lifetime. Secondly, which is the most commonly accepted, is the hormonal fluctuations or the hormonal imbalance, especially whenever you have more of estrogen in your inside your body. Example, whenever you have you if you are a case of PCOD, so the your estrogen levels are on higher side, you are predisposed of getting fibroids also. So, how do we classify fibroids? So, we classify fibroids into three types: the intramural, submucosal, and the subserosal. So, submucosal is that fibroid which is inside the endometrial cavity, which is going to be giving you a lot of symptoms and which is affecting your fertility as well. The intramural fibroid, that is, it is not inside the cavity, but it is inside the wall of the uterus, and the subserosal fibroid, which is outside the uterus. So, these subserosal fibroids are the ones which is not going to cause you any harm. All right. So, if you ask me the incidence of fibroids, it is almost in 50 to 70% of the girls, especially in their reproductive age group. So, not all of them are like symptomatic. Only 20-25% of the girls may have symptoms over their lifetime. And in relation to your fertility aspect, only 5 to 7% of the girls may have issues in relation to your conception or your reproduction in terms of your pregnancy because of the fibroid per se. So, what are the predisposing factors that yes, you might have a fibroid in your lifetime? So, in case if you have an early onset of menstruation, that is menarche, and in case if a girl gets a menarche at the age of 10 or before that, so she is predisposed of getting fibroid. Secondly, in case if you have a very strong family history, as I mentioned, if your mother, sister, aunt has a history of fibroid, so in that case, yes, you also may have a fibroid. Other parameters like delayed marriages, delayed childbearing, limited number of children, that is only one kid, and whenever you have obesity, diabetes, hypertension in your family, in that case, you are predisposed of getting fibroids in your lifetime. So, what are the symptoms? Do you mean that 50 to 70% of the girls who are having fibroid are they symptomatic? No, they are not. So, almost 80 to 90% of the girls won't have any symptoms. The only thing is they might come up with an incidental finding on the ultrasound. Yes, they might have a fibroid, but those are completely asymptomatic fibroids. So, fibroids may present with multiple symptoms. The most common being the menstrual symptoms, and the other being the pressure symptoms. So, menstrual symptoms. So, whenever she has a fibroid that is located inside the uterine cavity or inside the wall of the uterus, she might have very heavy periods, and that could be lasting for 10 days, 12 days as well. Second, it could be leading to lot of pain during her period. She might plus a lot of clots, and it would be like really painful periods for her with associated with lower back ache. There are many girls who complain of they get periods like within twice in a month or thrice in a month without any spacing in the menstruation. So even this is a classical history that you might have a fibroid. Second most common symptoms which may arise from a fibroid, whenever it is large fibroid, it could lead to pressure symptoms. So she might complain of urinary incontinence, or she might have an urge to go to urine every now and then, but whenever she goes to the washroom, she is not able to pass urine that much. So the incomplete sense of evacuation is always there. Second, she might feel a lot of heaviness or dragging pain inside the uterus because of the mass of the fibroid, or she might have also issues related to her motions, that is constipation. Now, coming to the part of infertility. So, fibroids per se may not lead to fertility in direct connection. Only 1.5 to 2% of the fibroids are known to cause any problem in terms of your conception. Yes, but in case if it is distorting the cavity, or if the fibroid is inside the cavity, which is acting as a space occupying lesion, in that case, the implantation of the embryo or the placentation of the fetus is affected. That might lead to failed implantation or a recurrent miscarriage. The second could be the mechanical effect of the fibroid. Whenever the fibroid is located inside the uterus, it might irritate the pregnancy, which might lead to other complications. Also, fibroids are known to cause certain complications or certain effects while you are pregnant. So, majority of the pregnant patients who are having fibroids, they are asymptomatic. However, they are also known to have first trimester miscarriages, that is recurrent pregnancy losses in the first trimester, that is before 3 months. So this is a classical history whenever you have a fibroid inside your cavity, and if the pregnancy is not continuing beyond 3 months, it may be because of the fibroid, and yes, it requires removal. Secondly, it may cause you a lot of pain during your second trimester, especially in the fifth and the sixth month, and that is because the degeneration of the fibroid, which you typically call them red degeneration of the fibroid. Third, yes, it might lead to preterm labor pains. It might lead to preterm delivery as well. Secondly, it could lead to abruption, that is removal of the placenta accidentally, leading to bleeding during pregnancy. And yes, it might lead to increased blood loss post delivery, also leading to PPH, that is postpartum hemorrhage. So, how do we come across the diagnosis of a fibroid? So, as I mentioned, the classical history of fibroid is like whenever you have menstrual related problems, or you have pressure related problems, or if you have classical recurrent pregnancy losses in the first trimester. So, that gives us the clue that yes, you might have a fibroid. Second, we can do clinical examination. If your uterus is bulky, distorted, that can be seen clinically also. Third, the most important is the imaging modality. So whenever we do an ultrasound, it is a classically seen, the fibroids are classically seen. But yes, the 3D ultrasound, that is the gold standard of diagnosis, where we come across to know the number, the size, the location of fibroid, whether it's indenting the cavity, whether it's inside the cavity or not. So, if you ask me personally, the most important diagnostic modality is a 3D ultrasound, especially if you're looking out for fertility or pregnancy related issues. The differential diagnosis of a fibroid, sometimes we might get confused with the fibroid with a term called as adenomyosis, which is slightly different. Whenever you need to reconfirm the diagnosis, sometimes MRI is advisable, but certain times the classical imaging of the fibroid is usually seen. So coming to the managing part, so how do we manage fibroids? So we have multiple options that are available to treat a fibroid, right? From a medical management to a surgical management to remove the fibroid, or we have the recent technologies like the embolization, the HIFU. All these are like important in terms of your fibroid. However, whenever we are looking out for fertility issues, embolization, that is, we are blocking the blood supply to the fibroid, and the HIFU, that is high intensity frequency ultrasound, that are contraindicated whenever you're looking out for pregnancy. So these two modalities are out of question. Coming to the medical management, there are many medical ways that we can go ahead to treat a fibroid. However, whenever you're looking for fertility point of view, these medical medicines may not be that worth. So we have other medicines like a plain analgesic, or a mifepristone, which is a progesterone antagonist, or a progesterone receptor modulator, that is a ulipristal acetate. These all are available. However, these can be given to girls who are who have already completed their family, or they are not looking out for pregnancy as of now. So once that is done, you can use these particular medicines. Coming to the last option, that is a surgical option. So initially it was thought hysterectomy was the choice for a fibroid. Nowadays it is out of question. We do not do hysterectomy anymore. What we do is we can remove the fibroid. We have various approaches. We can do it by open surgical, that is a conventional method. The second is a laparoscopic way or a hysteroscopic way or a combination of hyster and laparoscopy. So that depends upon the expertise of your surgeon. Basically, we do not want to touch your uterus. We want a minimal handling of the uterus and the other tissues. So everyone abroad, everyone in globally accepts that yes, histolaparoscopy is the treatment of choice for myomectomy if it is required. So does all the fibers require a removal? No, it is required only in special cases wherever it is indenting the cavity, or it is distorting the cavity, or it is inside the cavity. Only in such cases the fibroid has to be removed. Second indication is whenever you have undergone multiple cycles of IUI and IVF and that have failed. So that means that the fibroid may be associated with your fertility and that warrants a removal. Third, if the lady is having multiple miscarriages, that is recurrent pregnancy losses, especially the first and the second trimester, in that case, removal of fibroid will be helpful. So just to summarize the complete topic, so fibroids are the most common growths which are completely non-cancerous, found in almost 50 to 70% of the girls in their reproductive age group. These are easily manageable. In terms of your fertility, they are only responsible for 5 to 10% cases. Whenever the fibroid is inside the uterine cavity or it is distorting the uterine cavity, or especially if you have recurrent miscarriages associated with fibroid, those fibroids need a surgical removal. So wishing you all the very best. Thank you so much. I like to answer all the questions which are coming forward. Yeah. So can we have the questions, please? Okay. There are multiple questions that have come up. Okay. So the first question is like, doctor, what size of the fibroid can cause infertility? Uh, See, the size of the fibroid, basically, it's not only the size of the fibroid, but it's the location of the fibroid that is also important. So, in case if we have even a 1 or 1.5 centimeter fibroid that is submucous, that is indenting the cavity or distorting the cavity, that has to be removed. Or in case if the size is more than 4 or 5 centimeters, which is intramural, that is inside the wall of the uterus, even that requires a removal of the fibroid. But yes, if you have a fibroid which is 1.5 or 2 centimeter, which is outside the uterus or inside the wall of the uterus, which is completely not indenting the cavity, those fibroids can easily be ignored. You do not need any sort of treatment for that. All right. Okay. Second question is, what type of fibroids affect fertility the most? Yeah, as I mentioned, the submucosal fibroid, the FIGO classification, they have mentioned type 0, type 1, and type 2. These fibroids, which are like inside the cavity and just indenting the cavity, these are the fibroids which are known to affect your fertility potential by means of failed implantation, or the embryo growth or the fetal growth is affected. So these fibroids require a removal of the removal surgery. The next question, what size of fibroids are considered to be most dangerous? Yeah, I think we have covered up this question. Just to mention, the size is not actually that important. The size as well as the location, both of these things are dangerous in terms of your fertility. So even if you have a small fibroid, 1.5 to 2 centimeters, or even 1 centimeter for the matter, inside the uterus, inside the cavity, in that case, it warrants removal. Okay. Should we adapt to any lifestyle changes to avoid recurrence of fibroids? Yes, surely. So, in case if you have a history of diabetes, or if you are hypertensive, or in case if you are like on a higher weight gain, in that case, maybe you can improve on your lifestyle management. You should avoid too much of calorie intake, do regular exercise just to maintain all the weight parameters in normal. Keep in check your sugar levels and the blood pressure levels, so that will help you to reduce the incidence of or recurrence of fibroids to some extent. Secondly, if you're not looking out for fertility, in that case we have multiple options, those are available in terms of medicines. So we can give you certain medicines which you can continue till the time menopause is reached, and once the menopause is reached, these fibroids will eventually dissolve, so you won't require any treatment post your menopause. Okay, coming to the next question. Doctor, does the treatment for the fibroids cause any side effects? See, whenever we are contemplating a pregnancy, in that case, medical line of management is actually not very much desired. What we look out for is like a surgical management where we remove the fibroid with the help of a surgery. Most commonly, we do a laparoscopy or a hysteroscopy. So basically, hysteroscopy is doing putting a camera inside your uterus directly, and with a small knife or a resectoscope, we cut off the fibroid from inside only. So though there won't be any stitch or any cuts on the private parts. In case if required, we may have to go ahead with the second approach, that is a laparoscopic myomectomy, which involves only one or two cuts over the abdomen. But however, as such, there won't be any side effects because of this myomectomy. Coming to the side effects of the medical line of treatment, there could be some amount of side effect in terms of whenever we stop your estrogen production, you might face some hot flushes or osteoporotic changes. So in that cases, we may add you with some adjuvant treatment if required. But as such, no lethal side effects or no dangerous side effects are seen even with the medical line of management. These are very well tolerated by patients. Okay, coming to the next question, can fibroid be cancerous? So, as I mentioned, fibroids are 99% non-cancerous. Only when you have a genetic predisposition, so that if you have your family member like your mother, your aunt, or somebody in your family who had a history of uterine cancer or a breast cancer, and if the fibroids are like too big, and especially when your age is more than 40 or 50 years of age, in that case the fibroid may come out to be cancerous, and that the incidence is only 0.5 to 1% only. Otherwise, 99% of the times these fibroids are completely benign, that is not cancerous. Okay, the next question is, Doctor, how do I know for sure that I have fibroids? See, for sure, if you ask me, you can just do a routine ultrasound or preferably a 3D ultrasound. So that will diagnose the smallest of the fibroids, which is inside the uterus. Plus, it will help us to know the exact location, that is the fibroid mapping, and the number of fibroids that you may have. So maybe a 3D ultrasound, if not possible, only a 2D ultrasound will help you to diagnose whether you have a fibroid or not. Secondly, you might have a clinical history, like period related history, that you have two heavy periods or frequent periods in a month or so, or painful periods. So even that is indicative that yes, you might have a fibroid. Okay, the next question, can you still be fertile with fibroids? Yes, obviously, there are, as I mentioned, almost 50 to 70% of the girls may have fibroids in their lifetime. So even if you have a fibroid, you can still get pregnant and you can still deliver normally. So that is not a problem. The only thing is if the fibroid is too big, or if the size of the fibroid is too big, or the location of fibroid is such that it might interfere with the implantation or the growth of the fetus. In that case, yes, you might require a treatment option. Otherwise, these fibroids are really benign, and they won't cause you any problem during your pregnancy or during conception. Any more questions? I presume there are no more questions. Anyways, wishing you all the very best. I would look forward to see you again in the next topic, which will be coming soon. Uh, have a very good day ahead. Thank you so much.
Thank you, doctor.